for joining us. I'm Blaine Tollison.
And I'm Susanna Black. We want to get you caught up on 3 things that you need to know. First, today, South Carolina is honoring all of those lost during the pandemic, along with the doctors and nurses who have saved countless others. It's all part of Governor McMaster's statewide day of prayer. He asked people to also pray for people who are struggling financially. And struggling restaurants are hoping to get back on their feet. Today, South Carolina restaurants are preparing for their biggest day in several weeks. Starting tomorrow, they can resume outdoor dining.
And relief appears to be on the way for North Carolina. Yesterday, state lawmakers approved $1.6 billion of federal funding to help families and businesses affected by the pandemic and boost the medical response to it. And all that money is going to go to a lot of different places. And there's so much of it, we can't get to it all, but we do have a look at where some of that money is expected to end up. First, in our schools, $75 million for school nutrition, $47 million is for remote learning resources, including improved internet connectivity and devices for teachers and students. And in the medical field, $85 million would be spent on research. The UNC Collaboratory, Wake Forest, Duke, East Carolina, and Campbell universities would each get a big chunk of that money to study the virus. $50 million is allotted for buying personal protective equipment. There's $25 million for testing and tracing, and $20 million to hire more nurses, healthcare workers, and for more telehealth services. There's also $150 million for local government grants and $125 million for small business loans. And even though the agreement did have bipartisan support, the governor does have the final say on all of that money. And he released a statement yesterday saying that he is going to closely review the plans and take action on them soon. And he thanked lawmakers for passing the measures quickly. And we just threw a lot of numbers at you there, so we have a more detailed breakdown of where all that money is going inside this story on our news app. In the last hour, North Carolina reported 155 new cases of COVID-19 and 2 new deaths. Avery is now the only county across the state without cases. And that is a day after the state reported a new daily high of 586 cases. But the state not just looking at that number, they also keep an eye on the number of tests and the percentage that are coming back positive. It is in fact one of their key metrics for reopening businesses, and it needs to be on a downward trend over a 14-day period. The percentage of positive tests did drop almost every day last week, but yesterday it did go up. In South Carolina, there have been nearly 6,500 cases and 267 deaths. And today, South Carolina restaurants, they are getting ready for their biggest day in several weeks.
Yeah, starting tomorrow, they can resume outdoor dining. Now, tables have to be 8 feet apart, and there can't be more than 8 people at a table. Last night, we asked some customers in Fort Mill what they think about the reopening.
There's been a lot of harm done to the small business and particularly restaurants, and I think it's time to, in a smart way, to open them back up.
I still think it's too soon. Like I say, you're just going to open up another can of worms.
Now, we asked the SC Accelerate Task Force when indoor dining could resume. They told us it depends on 3 things: how outdoor seating goes this week, if cases start leveling off, and the food supply chain. If all goes well, indoor dining could resume next week. Meanwhile, North Carolina's stay-at-home order could be allowed to expire this Friday. And if that happens, that'll trigger the first of 3 phases to reopening the state. In phase 1, you'll be able to travel for reasons that are not essential. And some non-essential businesses will reopen, like clothing stores, sporting goods stores, and bookstores. The second phase could come 2 to 3 weeks after that. It would allow restaurants to open, but still encourage people who are vulnerable to catching the virus to stay inside. The last phase would be 4 to 6 weeks after that. It would allow increased capacity at churches, restaurants, and other businesses. Now, the North Carolina Restaurant Association sent Governor Cooper a letter on Friday asking him to allow restaurants to reopen for dine-in sooner than planned. The group says that only 35% of the state's restaurants can afford a shutdown of 2 months or more. It says restaurants should adopt strict health safety rules, like fewer people in restaurants and tables spread apart.